Welcome to AAMG YouTube live channel. So we are very honored to have our Dr. Kevin Ho, and he's our ENT doctor at AAMG and serving the San Francisco Bay Area for many years. Today, he's presenting how to deal with seasonal allergies. So Dr. Ho, were you able to explain your experience to our channel members or audience?
Sure. Thank you, Esther, for inviting me to talk about seasonal allergies today. I'm Dr. Kevin Ho. I'm a San Francisco ear, nose, and throat specialist. I've been in practice in the Bay Area for 10 years. And today's topic is how to deal with seasonal allergies. So the reason why we want to talk about seasonal allergies or allergic rhinitis is because it is a disease or illness that affects a large number of patients. And it is estimated that about a third of US citizens are affected by seasonal nasal allergies. And in 2018, it is estimated that more than $5 billion of medical costs attributed to allergic rhinitis, and more than 6 million loss of school or work days per year are also attributed to allergic rhinitis for US citizens. When we say allergic rhinitis, it is synonymous to nasal allergies or allergic to pollen allergies. So it's just a medical term that describes our allergic response to pollens, dust, different various allergens. Some patients would call it hay fever. It's kind of a misnomer because we're not just allergic to haze. Patients are not just allergic to haze, and patients do not typically develop a fever with allergic rhinitis, but you may have heard a lot of patients refer nasal allergies as hay fever. As I said, there are a lot of common allergens that we face every day. Overall, we can group it into outdoor versus indoor allergens. In terms of outdoor allergens, we have tree, grass, pollens. Those are the main ones. And indoor allergens, the one in the bottom, mold, dust mites, and pets are very common indoor allergens that cause nasal allergies. So in general, when we talk about pollens, trees and grass, normally we see tree pollens usually affect people in the springtime, and grass sometimes in the summer. And in the fall, we see patients affected by red weeds. And those things, if you look closely at the Weather Channel, sometimes online or on the website, you can find out about those information about different levels of allergens in the air. So if you know you're allergic to a particular kind of things, you can check the weather report ahead of time so to find out whether those allergens are at a high level in the air for that day. There are also non-allergic rhinitis. What do I mean by that? Those are the factors that affect the nose that one may not be able to detect very easily or cannot be tested very easily, but yet people are still responsive to it. For example, air temperature changes, humidity. A lot of people may wake up with temperature changes, for example, they wake up with running nose and stuffy nose in the morning. Those patients may experience response to changes in the temperature or humidity, or they may be also responsive to pollutants in the air. We live in a very condensed society, and I came from Hong Kong, and a lot of patients, when they walk down the street, on a busy street, they can be affected by the dust and the pollutants, and a lot of them are affected and have nasal congestion and nasal symptoms. What causes allergic rhinitis? It is actually an immune response. It is a hypersensitive reaction to different allergens. There are inflammatory mediators in the body that when our body have, when there are allergens in the air, when we breathe in these allergens, our body will respond to it and release these inflammatory mediators. These mediators will release different chemicals and cause inflammation of the mucosal lining of the nose. And that in turn would create some congestion situation and also running nose and also other symptoms that we're going to describe later. So like I said, nasal obstruction, nasal congestion is a very common symptom. Running nose, very common symptom. Sneezing. In terms of the throat and the nose, sometimes the running nose can drip down to the back of the nose or the back of the throat and cause a minor sore throat or hoarse voice. And people can also have cough symptoms. These symptoms are sometimes confused with common cold. So what's the difference between nasal allergy, allergic rhinitis, and common cold? Typically with common cold, one can develop a fever, one can develop a more severe sore throat, and the duration of symptoms of common cold are usually shorter. Usually patient recover within a week or two. But for allergic rhinitis, it can run obviously for the whole season or the whole year. Now, what is sinusitis? A lot of people are confused between sinusitis and allergic rhinitis or nasal allergies. Sinusitis are simply inflammation or infection of the sinus cavities. As we see in the picture on the right, the yellow are those infected fluid or pus that can be located in the sinuses, in this case, the forehead sinus or the cheek sinus that we all have. And for sinusitis, we can classify it into acute versus chronic. For acute sinusitis, patients usually experience pain in the sinus or even pain in upper teeth because the cheek sinus are infected or inflamed, and they can have discolored nasal mucus and or fever. For chronic sinusitis, patient can develop loss of smell and or nasal congestion. Nasal polyp is something that we see very often with patients with chronic sinusitis. And those patients can have nasal allergy as well. But for us to see nasal polyp in a patient, that means that those patients have had long-term chronic situation, chronic inflammation of the sinuses. And that create the excess growth tissue in the nose that we can see in this picture. And as you can see, because the nose are blocked by these nasal polyps, it can create stuffy nose, and also it can block the sense of smell. Asthma is a condition that can coexist in patients with allergic rhinitis. Because asthma is a condition that affects the lower respiratory tract, and allergic rhinitis typically affect the upper respiratory tract involving the nose and the throat. Those two conditions can happen very commonly together. That's why we would like to treat patients with asthma. Also, we want to maximize the treatment for the nose because the upper respiratory tract and the lower respiratory tract are connected. As we maximize the treatment for the upper respiratory tract, then the lower respiratory tract disease such as asthma can also be benefited, and the symptoms would also be relieved. How do we make the diagnosis for allergic rhinitis? As with many diseases, getting a good history is a good first step. For example, you can ask about the symptoms that I described with the running nose, the congestion, and the timing could be very important in terms of what time of day, what time of the season that the patient experience allergic rhinitis. And also we like to also ask about what situation or what environment that the patient is in when they have these allergic responses, allergic symptoms. For example, in the outdoor setting during a certain season, then we can deduce that the patient may be allergic to certain things, certain pollens in the air in those seasons. Or if they're having more symptoms in the indoor setting, then maybe we can focus more on things like dust mites or pets that people usually experience inside a house. Allergy skin testing is a very important tool to help us diagnose allergic rhinitis. As you can see on the picture on the right, the provider is putting in some allergens into the skin. And after about 20 minutes, you can examine the response, as you can see on the left side picture here, the one that shows a wheal of a certain size. After 20 minutes, we can measure the diameter, and those with allergic response to different allergens. So each wheal corresponds to a different allergen. For example, this can be dust mite, the other one could be pollens. The ones that the patient show more response or a bigger wheal to that allergen, then we'll record it down and as a positive response. The importance of an allergy test is that once we determine which allergen the patient is allergic to, then we can avoid it. For example, there are things that we can simply avoid or minimize in the indoor setting, such as dust mites. Dust mites, as you know, can live on the carpet or in your bed sheets or pillowcases. So there are things that you can improve by, for example, having a dust mite-free pillow covers or blanket sheets that can be easily purchased online or in the department store. The other things you can try to improve indoor would be maintaining the humidity and the temperature. So knowing what you are allergic to is very important. Antihistamines are a group of medications that are used to treat allergic rhinitis. It can be in pill form, it can be in syrup form, or it can be in nasal spray form. They are medicines that are used to control the symptoms of nasal allergies. I use it a lot when patients have running nose, they have itchy nose, itchy eyes. These antihistamines are very useful in controlling these symptoms. These medications are mostly you can buy over the counter now. So the ones you found in the pharmacy over the counter are these kind of antihistamines that are widely available to patients. Now, nasal decongestant is also a group of medications that can be purchased over the counter. The one on the left called Afrin is a nasal spray that is used a lot for patients with stuffy nose. A lot of patients use it to control or improve their nasal congestion. I do want to point out that there's a condition with long-term Afrin or nasal decongestant use that can actually cause what we call a rebound congestion. When we use Afrin for a long time, the body will get used to it, and also it changes how the nose is responsive to some of these allergens, or it's responsive to different temperature changes or humidity changes. And if you use Afrin for a long time, the minute you stop using it, the nose would become actually very congested. And that's why some patients will get addicted to it and create some long-term dependence on it. So have to be very careful about that. Now, Robitussin and Sudafed or Sudafed are often also used as an oral decongestant to treat the symptoms of nasal allergies or allergic rhinitis. What we as a ear, nose, and throat providers use a lot in terms of treating the allergic rhinitis are nasal steroid sprays. When patients hear about the word steroid, sometimes they're a little bit hesitant to use it. Nasal steroid spray actually works more locally in the nose to help reduce the inflammation or swelling of the nose tissue. And so it is very effective in controlling symptoms of nasal congestion and running nose. There is a minor side effect that I always tell patients, that the nasal steroid spray can cause a little thinning of the nasal skin or membrane. And sometimes for patients with nosebleed, then I would warn them against it or be very cautious about using it. But overall, nasal steroid spray is a very safe medication to use long term. And overall, it doesn't really affect the rest of the body in terms of, for example, blood sugar level or body weight, as you would expect for long-term oral steroid use. Nasal turbinates are the structure that is shown here in this picture. These are the lower turbinates, these are the middle turbinates, these are the top called the superior turbinates. We all have it. The function of turbinates, they have the mucosa or membrane that is responsive to different allergens. And when we inhale those pollens or dust in the air, these turbinates will have the response to create, sometimes if patients are allergic to it, they will become more swollen and also have more secretions. So it would create more running nose and stuffy nose situation for those patients. As I said, the nasal steroid spray would reduce the inflammation, and typically it acts on these turbinates and it helps shrink these turbinates. So for patients who use the nasal steroid spray, you would expect the nasal turbinates to become less swollen and have less secretions over time. And so it can improve the nasal symptoms that way. For the patients who have seen me once or even for a number of years, they would know that I am a strong advocate for nasal saline irrigations. It's simply using salt water to irrigate the nose or rinse the nose. It has been shown to improve the symptoms of nasal allergies and even minor sinus infections. The purpose of rinsing with saline is simply that you can rinse out the pollens in the nose. And also the salt water can take away the water content in the body, so it can reduce the amount of congestion. Those nasal saline irrigations can be purchased over the counter, and also you can make those saline solution at home. You can simply use non-iodine salts, and you can add a little baking soda to it. For example, for an 8-ounce bottle, you can add about half a teaspoon of non-iodine salt and a little bit of baking soda. Again, the combinations can vary according to your taste. In general, those patients who have used this nasal saline irrigations found it very helpful, and they usually would adjust the amount of salt to their liking. Functional endoscopic sinus surgeries is a tool that we as a ear, nose, and throat specialists use to treat chronic sinus condition and nasal polyps. As I said, we see chronic sinus conditions and nasal polyps also sometimes in patients with nasal allergies. So for those patients who have blocked sinus cavities and or nasal polyps that cause stuffy nose and loss of sense of smell, we usually would get nasal endoscopy or using a camera to look inside the nose to confirm the diagnosis and get some imaging to locate the area of obstruction or the extent of the nasal polyps. And then we may recommend sinus surgery if the medical therapy fails. These surgeries can be done in the hospital, and more recently can also be done in the office under local anesthesia. As I said, the treatment for allergic rhinitis can be, you can avoid it. You can avoid the allergens. If you cannot avoid it, you can use topical or nasal medications to treat it. The third category that doctors use to treat allergic rhinitis is immunotherapy. The way we do it is once we determine which allergens a patient is responding to, then we can target those allergens and provide injections specific to those allergens to the patient in an increment dose over a period of time. Usually the treatment can last 3 to 5 years, but usually for patients who have done it over 6 to 12 months, they can see some improvement. And the way it works is that these injection or these shots will slowly modulate or change the way the patient's immune system is responding to these allergens. So over a period of time, the patient becomes less responsive or less allergic to those stimulus. So in conclusions, allergic rhinitis or nasal allergies is a very common chronic problems that we face every day. Avoiding the allergen is very important, and obviously identifying which allergen you're allergic to is very important. Anti-allergy medication is not the only solution. We have immunotherapy that can also help us to treat these patients. Thank you very much for your attention, and I'd like to thank Esther and AAMG for allowing me to share this information online.
Thank you so much, Dr. Ho, for a wonderful presentation.
For more information on other health topics, please visit the AAMG Health Education website. If you like this video, please give a like and subscribe to our channel for more related content.